of the Hillingdon Hospital's podcast. I'm here with Elaine Hodson, who is the Trust's Health and Wellbeing Lead, and we're going to be talking about this year's Staff Awards and the nominations process. So, to start us off, can you tell us a little bit about why we have Staff Awards and what plans we have for this year?
Yep. So we all know that there is some fantastic work that happens all the time in our trust, and it is really important for us that it is formally acknowledged. So the annual staff awards, that's just one way for us to recognise our amazing staff. And it is a lovely opportunity to bring all of our staff together for a celebration for our people and of our trust. So we try to run them every year, and anyone can nominate someone. So we are holding an even bigger ceremony this year, so more of our staff can attend, and we hope to see as many nominations coming through as possible.
So what are the categories and how can someone put someone forward?
Right, so we have 5 awards that recognise people who exemplify our Trust Care's values. So what are we looking for? We are looking for people who are excellent communicators. These are people or teams who make sure that they listen to others and that they communicate clearly. Those that have a great attitude, constantly striving to understand others' needs and responding with care, compassion, and professionalism. People who take responsibility for consistently delivering excellence and being open in all that they do. Those who show a commitment to equity, understanding that everyone is different while valuing everyone equally. And staff who show excellence in ensuring that patient, staff and visitor safety is a priority. Now, we also have the CEO's Dedication and Achievement Award, which recognises a member of our staff who has worked at the Trust for more than 15 years and has made an extraordinary contribution to our Trust and our community. We also have the Chair's I Am the Change Award. It is for a person or a team who has demonstrated innovation or improvement, creating a positive change for all of our patients and colleagues.
And there's one more category this year, which of course is the public vote. So why has that been introduced and how can people get involved?
Yeah, so we now have that, as you say, a new category of the public vote. So many of our patients, they write to express their gratitude for the care that they have received. So we thought it'd be great to formally recognise that feedback and to make sure that our local community has a chance to get involved with the nominations process. So if you're a patient, a member of the public, and you want to say thank you to our staff members, you can complete the online form, which you'll find on our website, and you can put them forward for the Public Vote Award.
So it's a similar process for staff as well, isn't it? So if staff want to put someone forward, where can they find that information?
So we did change it up a little bit this year. So we've made our nominations process an online process. So you can actually go to the internet, you will find a link there and click on the teams, click on the individual links, pops you into a nice MS Teams form, takes a couple of minutes to fill in. So come on, get nominating.
Brilliant. So if you're completing that application process, is there anything you can do when you're writing it to help increase their chances of being shortlisted?
Yeah, so the judges, they will be looking for people who clearly meet the criteria for each of those categories. So if you can provide a clear examples of instances when that person or team has demonstrated a particular care's value or the impact of a change they have introduced, that will all help.
Brilliant. And a final question, how long have people got to do this? What's the deadline?
So it's getting shorter. So nominations close on the 12th of July. So there's only a couple of weeks left to get those forms in. And we are hoping to announce the shortlisting sometime around the middle of August. So just so you know, right now we have exceeded the number of nominations for individuals and teams that we received last year. But come on, keep those nominations coming in. The more we have, the more we can celebrate our staff.
Brilliant. Thank you so much for taking the time to talk to me.
You're more than welcome, and have a good day.